That's right, I got a part 7 of how to be an art therapist in a mental health facility. So again, this is really dependent on the type of facility that you are working in, but where I'm at, we are like a crisis center, so these are short-term stays. So it's a little different than some of the privately owned facilities where they could be long-term, it could be up to a month, but typically I'm looking at 2 to 3 weeks tops for most of my patients. So the major difference here, especially between like a private practice and working in a facility like this, is I'm doing crisis intervention. This is not one-on-one. This is not where I'm really sitting with the patients and doing work, which occasionally does happen. Actually, today in my groups, I did get a smaller turnout for groups, so I was able to really concentrate and actually sit with the patients and do artwork. So that's like a great day for me, but it doesn't happen often. So the main part of my job doing the crisis intervention is really just trying to maintain the level of calm for the group. So my patients come to me and they know that I got music playing and we're gonna make art, and it's gonna be a really chill vibe, and they all appreciate that. So they walk out of that group room and there can be chaos or it can be kind of calm. Most part is like they're all still getting to know each other, so working in the groups, keeping that cohesiveness, and also just allowing them to breathe and relax and not have that chaos that they're dealing with, you know, outside in the facility itself. That's my job, is maintaining that calm for them. So part of that crisis intervention is giving them coping mechanisms, things that they can do to stay calm, to release their anxiety and stress and keep those levels down. And most of it just has to do with distraction. So I love to give them things to do that they can do at home. For instance, the coffee filter thing that I did the other day, they are still talking about it because A, it's a cheap activity, but B, there's like, they could spend hours doing it, and most of them are even talking about doing it with their kids or their grandkids. So it's like something that they're learning that they can take home with them and really benefit from when they're feeling stressed or overwhelmed, or maybe they just need a great distraction in that moment. And with that crisis intervention, while they're making art, this is where the conversations flow. And it's not just with me, I hear it among the patients. Yes, I do partake in some of the conversations and sometimes I do interject, but for the most part, I just let them talk and talk it out. And I do say things when things are being said that aren't correct or maybe not so kind. That's when I feel that is my job, my role to intervene. But for the most part, I just sit and listen to everything and their experiences and what they're sharing with their peers that are in there with them. And it's really like a great bonding moment. And I'm just proud to be part of it. And I'm honored also to be in that room with them, and they're comfortable enough to share, you know, with me, with the other people that are there as well. Stay tuned, I have more. I'm Jean and I'm an art therapist.